Stem cell transplant is often considered for myeloma patients. Can you talk about who this treatment option might be appropriate for?
Absolutely. So we've known for decades that what I call high-dose chemotherapy, also called stem cell transplant, is a very effective and very potent treatment of myeloma. And we've shown that time and time again in clinical trials, including some recent ones that were published just in 2022. And so, but high-dose chemotherapy and stem cell transplant is not for everyone. You have to be fit enough to undergo it. And this is not age determined, it's fitness determined. And then there are a lot of people live a long way from centers that perform high-dose chemotherapy and stem cell transplant. So if patients have to travel hundreds of miles, then sometimes that comes into play. Hey, I just can't do this. I can't get the time off and uproot, and bring a caregiver and travel 300 miles to get this care. So sometimes that comes into play. Physician bias definitely comes into play. We know that some physicians are stronger proponents of high-dose chemotherapy and stem cell transplant, and I fall into that category. But we have other physicians that may not even bring it up as an option to their patients. Oh. We know, for example, that African Americans and other minorities are notoriously underreferred for high-dose chemotherapy and stem cell transplant. So a lot of decisions go into that. And again, this is one of those situations where if you're transplant eligible, that means you're young and vigorous and on paper a candidate, you ought to go at the very minimum consult with physicians that do high-dose chemotherapy and stem cell transplant and hear about that option.